Hi, it's Dr. Kimberly Gartman, independent consultant with Arbonne International and practicing family practice physician. I wanted to come to you with another 5-Minute Friday, and today's feels really important to me, especially in light of COVID-19 pandemic, but really just in general. And the reason is because today we're going to talk about inflammation. And I know there's been a lot of talk about inflammation in the last few years, and there's actually a good reason for that. We're really learning that it can be a root cause of a lot of problems in our body. So what even is inflammation? Well, inflammation is basically the body's or the immune system's response to perceived injury or infection. So like if you have trauma or you get an infection, your immune system sends chemicals rushing to that area to fight that off or else to heal it. That's good. So that's when in that circumstance, inflammation is really good. It draws your body's attention to a problem and it takes care of it. And so that's a really good thing. The problem is when we have chronic inflammation. It's really bad when inflammation is triggered by things like toxins, things we put in our mouth, on our skin, that we breathe in, chronic stress. Anybody feeling any chronic stress right now? We're pretty stressed with all that's going on. Obesity, and that one's really interesting and intriguing to me, and we're going to talk about that just a little bit more. And then autoimmune disorders. And the reason why this kind of inflammation is bad, the reason why it's not like good inflammation, is because instead of getting the job done and getting out like our body is designed to do, our body is designed to use inflammation for that, it just hangs around, causing all kinds of problems throughout the body. It's not targeted, it's diffuse, and it just hangs around, and it does damage to our bodies. What can happen when that inflammation persists over time is it can lead to a lot of illness rather than fighting it. And the illnesses that we know that chronic inflammation leads to is heart disease, arthritis, depression. And I'm seeing as a physician more and more depression and anxiety right now. And I think a lot of it has to do with chronic inflammation, chronic stress, and then it's perpetuating that. Alzheimer's disease, dementia, many different types of cancer are caused or exacerbated by chronic inflammation. And then now, the thing that got my attention right now is that we now know that people with chronic inflammation have worse outcomes with COVID-19 infection. That should get your attention. I mentioned obesity a minute ago, and before I talk about that, I want you to understand that I am not fat shaming. We all have our own issues, right? And I'm not trying to say that you can just magically fix that, but I want to bring your attention to a study that came about just recently, in the last week actually, from some doctors at NYU, where they have had plenty of COVID-19 to look at, unfortunately. And one thing that they found, which was a little bit startling, is that obesity by itself, separate from diabetes, heart disease, high blood pressure, all of that, is linked to much more severe disease, especially in the under 60 population. Y'all, that should get your attention. What the heck? Well, the reason is because of the inflammation, we believe. And why is obesity causing inflammation? I mean, how does that even work? Well, adipose tissue or fat tissue, fat cells, aren't just sitting there. They're not just inert, making your pants not fit well. They are actually, fat cells or adipose tissue is actually considered an endocrine organ, much like the pancreas. It just has different functions. And one of the things that adipose tissue does is release chemicals called cytokines. And these are inflammatory agents. And so unfortunately, the cytokines that come from adipose tissue don't have anywhere really to go, and so they just float around, making us more inflamed, and that chronic inflammation that we were talking about. So what do we do about that? Obviously, if you're carrying extra weight, you can't just magically make it disappear, right? But what I've noticed is a lot of people are going to their comfort foods in this time because it's stressful. And so we want to reach for sugary treats or carbs and things like that because they make us feel better. But ultimately, they're going to wreck us. And so I'm not saying you can't have a cookie or some ice cream or some mac and cheese or potatoes occasionally. But please, I beg of you, don't let that be your go-to right now. What we need to do is avoid a lot of red meat, refined carbs, added sugars, fried foods, sugary drinks, because those things increase adipose tissue and increase inflammation on their own. So what do we do about it? If we can't magically take weight off or magically just get rid of all the inflammation, well, there are things we can do. We can get regular exercise. And don't roll your eyes at me. I know that we say this all the time, but it really does matter. We need exercise, especially now for both our physical and our mental health. We need 15 minutes of direct sunlight every day. It helps our mood. It makes us feel better. It reduces inflammation. We need good sleep. And that's hard right now if you're stressed, but we can do that with mindfulness, with melatonin, with yoga and things like that, with staying connected with people. And then we need to reduce chronic stress. And I know that's a tall order right now, but we can do that the way I just said. Practice mindfulness, do some meditation, take up yoga, FaceTime with family, do some things that will help you to manage that chronic stress that you're having and to get yourself in a healthier place. You guys, I want us all to do well in this pandemic. Even if we get the virus, I want us to have all the tools to help us to do as well as we can do. And then I want us to come out on the other side of this our best selves, with all kinds of tools in the toolbox to manage when other things come our way that are going to. We're going to have storms in life, whether literal or, spiritual, whatever. And so there are things we can do to reduce chronic inflammation in our bodies, help ourselves to be healthier, and in turn we will do better and live better, more abundant lives. Stay well. I hope this was helpful to you.